And let it out. I'm gonna drop that shoulder. Let it go, let that drop, let it drop. That was good. It's been a little bit. You saw a chiropractor back 8 years ago?
Yeah.
Right after a car accident. Okay, and you have some issues. You're obviously very fit, so you do fitness.
Yeah, I do.
What do you do?
I do bodybuilding.
Okay.
So I'm a figure competitor.
Oh, okay.
Yeah.
Do you have anything coming up?
Not right now.
Okay.
I do have a fitness competition coming up, but it's unrelated to bodybuilding, but it is a concern. It's brought some things to my attention, so.
Okay.
Yeah.
Okay, so you're here. We're going to check you out and see what we can do. Besides the disc issue that you talked about, is there anything else you're concerned about or that you're noticing when you're lifting, training?
Besides that, no. My hips, yes. There's a little bit of it feels like a little bit of like a hip shift going on.
Okay.
And I don't know if that's me compensating for that or where that can be coming from, but that's
So hip shift, like when you're doing some of the movements, like they're not tracking, or what do you know?
Yeah, like I'm finding stability more on like almost rotating. Yeah.
Okay. Okay, well, let me take a look at you. I'm turning face that way. So what I'm going to do, since this is the first time I've seen you, is I'm just going to take a look at you and see. The first thing I do is check for a pattern. Most people have one. And it's everything you've lived through in your life to this point. Yeah, so when I just look at your posture, your right hip, turn and face this way real quick, your right hip is quite a bit lower than your left, like that. So you are compensating quite a bit. And then anytime you're gonna move, your body's changing from your feet up to your head to make sure you can do all that, right? Our body's always protecting us. So how about if I push in here? Any pain?
No pain.
How about if I push in here?
No, no pain.
Okay, good. Now I want you to bring your right knee up to your chest. And down. Good. The left knee up to your chest. And down. Okay, so this left SI joint is not moving at all. So you have a pretty good fixation of the sacroiliac joint, right where the sacrum, your tailbone, meets that hip, right? And it should move like this when you bend forward or when you lift your leg, it should do that. It's not moving at all.
Oh, great.
So yeah, so even though you're not tender, I can see that already. Let me just see. Any headaches ever?
Yes.
Okay, how often are we getting headaches?
Not too often. They kind of flare up randomly.
Okay. How's your stress level?
Through the roof all the time.
Okay. You have a business, right?
Yes.
Yeah, yeah. That is a lot. So chiropractic is amazing for headaches. It can come from the upper neck and here, or tension throughout here, all of which can be related to stress. Any sort of regular headaches is not normal, right? It might be common for you, but that's something that we want to make sure we take a look at. Okay, let's just see how your head moves. So bring your ear to your shoulder and go the other way. Okay, and then look over your left shoulder and look over your right shoulder. Good. A little harder to turn this way, a little bit. Not real bad, but okay, now look up. Good, and look down, chin to your chest. Any pulling or tension through there at all? Okay, good. All right, so let's, I'm actually gonna check your squat and see what you're talking about with the hips and the rotation. So I'm sure you've been on a squat ramp before. So I'll just have you stand facing that way. Good, okay. So now just go down yourself. Let's see how that looks. Deep as you can, good. And how's that feel through the hips, front, side?
It's not too bad. I mean, it is tight pretty much always here.
On both sides or more the left side?
Probably more the left side.
Okay, come back up. And anybody who's any sort of athlete, I always feel like they have really good compensation patterns. Meaning you do really well even if you are out of balance.
Yeah.
All right, so now come down again slowly into squat. Okay, good. And then come back up. Okay, yeah, so again, I can see that left SI. I don't see a terrible amount of like I said, I think you have good compensation patterns. right, just step forward off of that, and then I'm going to check your activation between the shoulder blades. So turn and face the mirror. Let's just take a look in the mirror real quick. Okay, so, because symmetry is a big deal, right? Okay, so let's have you squeeze your shoulder blades down and together. Squeeze right here. Okay, and tell me what you see.
It's like one side drops.
Yep, and then this side, you have a little bit better activation over here, less here, and this is pulling back, right? So, okay, relax, perfect. Because I think, so then what I think of is I'm looking at the neurological stimulation from the lower neck, the upper back. It's really common, especially if you have a history of a car accident. So, okay, so I'm gonna look there. Yeah, I can see that a little bit. So then we'll take a look after and see what you notice. So what are you most worried about with the cracking? Just that you don't know what's happening, or?
Probably. I know that's like, it's normal to crack, right?
Yeah.
It's just like gases being released from the joints and stuff like that.
Yes, it's gas coming out of the joint capsule, and people can crack themselves, right? So I don't put too much good or bad on the crack, right? So getting an adjustment doesn't mean you don't get it just because it cracks, because otherwise then just cracking your own knuckles, and people that do this and would be adjusting themselves. So it's a very specific thing with a specific change in function in mind, right? So sometimes there's a crack, and we all like the crack, but there isn't always. I'm pretty gentle, so I'm never gonna force anything, because if it's not gonna do that, I'm not gonna force it, because then I'm overriding the body's protective mechanism. And then there are some people that shouldn't have their neck manually manipulated. Do you have any history of any cerebrovascular incidences, or not taking any blood thinners or heart medication? So, so we can go through. I'll start at the bottom. We'll work our way up. Are you most worried about the neck? Or
probably. That's probably where I'm gonna get a little like hesitant.
Okay.
But
well, we'll start at the bottom. We'll go easy, and we'll see. Yes, we'll see how you do as I get up there. Now, because you have talked about having a disc issue, sometimes when that's active, I won't do manual manipulation or twisting there. But it's been a while, and we really got to get that SI to move. So I think we'll start there.
Okay.
That sound good?
Sounds like
okay. Any questions before I start?
No.
Okay. So you're gonna get yourself comfy, lie face down.
Okie dokie.
You know, right in the middle there. Good. And just make a note. Okay, good. I'm gonna back real quick. Are these lifting shoes?
They're barefoot shoes, so yeah, somewhat.
What brand are they? Oh,
Vivo.
Yeah. Do you like them?
I do. You definitely give more of a wider toe box, so my toes aren't so cramped.
Yeah, I started wearing those. I don't run anymore, but I used to run, and I really like the barefoot feel. So what I'm also seeing as I lift you up is that probably have some lumbar stuff going on. So I'm gonna touch your butt, and we're gonna see if I'm right about your pattern. And what I'm guessing is that your right leg acts shorter than your left leg. So now I'm gonna just see if I'm right. So I always confirm before I adjust. Yes, we definitely need to start. So I actually need to start with your lumbars. How's that feeling there? That tender at all?
A little bit of pressure on that right side.
Yeah. I can feel it doesn't want to go that way. So we're gonna pull that. All right. So lie on which way? This side. Yeah. Sometimes when people are moving, I can't get my right and my left.
That's okay.
Come towards me. Very good, just like that. I'm gonna have you bend this good and this arm, and we're just perfect, just like that. So this is just a nice stretch, because I'm gonna encourage that L4 to get back into proper alignment, which will help take some pressure off of that area right there. Okay, so nice deep breath in and let it out. I'm gonna drop that shoulder. Perfect. How's that? Not so bad, right?
No.
Okay, go the other way. And I'm gonna, you survived! Come a little closer to me. Perfect, good. Well, it'll be fun to see how you do after, right? Because I think that'll make all the difference. Okay, move your bum a little closer to me. There we go, good. So you have nice flexibility. All right, so nice deep breath in. And let it all out. Good, let that drop. Perfect. Easy, right? After that. Okay, so now you're gonna go back on your tummy. And I'm gonna check and make sure. Perfect. That looks great. Perfect. So do you do any special diet or nutrition?
Oh yeah, everything is always dialed in all the time, depending on what's going on.
All the time?
All the time.
Yee.
Yeah. Bodybuilding's 24 hours, 365. You know?
Does it get tiring?
No, it's just my lifestyle. It's just the way I live.
Okay, nice deep breath in and let it all out. Okay, so this is just moving the sacrum, giving your lumbar some space. Breathe in and out. One more time, breathe in and out. Perfect. So is there any foods that you miss?
No. Honestly, my digestion is so sensitive now that I don't really miss any foods that would set that off. It's pretty much everything that I don't eat. I still enjoy myself from time to time.
Nice deep breath in and all the way out. Let it go. Let that drop. Let it drop. That was good. That feel good? All right, good. One more. Big breath in and out. Just a little baby one there. I'm just going to see how it is up here. So what else do you like to do for fun?
Besides training, I don't know, what do I like to do for fun?
It's your 24/7, 365.
Yeah, that like is my fun time. Netflix, I like watching movies.
What's your favorite? What's your favorite movie?
You know what? I don't really have a favorite, but I am watching a show right now, which is Daredevil. I guess it's now on Disney. It used to be Netflix, but it's really good.
What's that one about? Because I don't watch very much TV.
So I never did either. I swear, when I was on my own, I did not own a TV, but my boyfriend is a big movie buff, and so that's what we do. It's about this guy who's blind, who has all these enhanced senses, who ends up being like he's like a vigilante, but he's like the superhero. He's like protecting his city and the people in it from criminals, and it's like a superhero movie or show.
Was that ever a movie or was he a character?
Yeah, he was in a comic book.
Yes, okay.
Mm-hmm.
I feel like I saw a movie like that or something.
Yeah. I would have no clue if it was not for my boyfriend, I swear. Like, I don't watch this stuff, but it's good.
Okay, so I'm just going to come down here and adjust the lower leg bones that make up the knee and the ankles. Any knee or ankle stuff going on?
My right knee, actually, yes.
Okay.
It's always bothered me. That ankle definitely did that.
Yeah, that's a good one. Or both of them.
They both needed it. Their poor ankles.
Have you sprained them before, or is it just from
No.
wear and tear from training?
It's from training.
Okay. Good. Okay, so let's turn over onto your back. Leave that there just in case. Perfect. You're doing great.
Thank you for the reassurance.
Well, I can tell you're a little bit apprehensive. But so how did you feel after we went through the whole body?
Much better. Yeah. Instant relief.
So I think what I can tell right up here is that this is quite swollen and not moving as well. So that's more than likely where a lot of the headaches are coming from. And I would adjust your first cervical vertebra and then your second, C1 and C2. Blood supply, nerve supply to the head, the scalp. And I think you probably feel like your head is lighter. So let's give it a shot on one side and we'll see how you feel, okay? Good. A nice stretch already. Did you feel that? That was easy.
Yeah.
Now drop your right shoulder, let it drop. Perfect.
What was that? It was great. It was good.
Okay,
It was
good.
good.
Good. See, you're volunteering. I'm not having to do that much. That was really good.
Yeah.
Very gentle, very easy. Okay, so this is the knee that bugs you?
Yeah.
All right, so I'm actually gonna let me check the ankles first again. I know I adjusted them, but we're gonna really give them a little tug, long axis traction.
I thought my foot was about to fall off.
But see, I do this every day, and that was a really good one.
Oh my god.
Holy buckets! You're gonna be like an inch taller on that
I
side.
believe that.
All right, let's see what we got on this side. Wow, not as dramatic, but still really good. Good. How about your feet? How's your feet?
I think my feet are alright.
Yeah. Should we check them?
Probably.
Okay, we'll do that last. Let's check. I'm gonna check these knees first, okay? So this is one way I like to check. So we're checking internal rotation. So not bad. Pretty even. Let's check the muscle activation. Hold the leg out strong, but let me push it in. Hold it out. Good, just like that. So I'm gonna just test this patella. Hold the leg out strong. Isn't that weird? Like someone turned the electricity off. So most common is that you have the patellas pulled lateral. The muscles over here are almost always stronger than these muscles, even with someone who trains and knows all this. But that's more than likely what some of the tracking issue or knee issue you're having. Now hold it strong. So now I'm pushing in and we're locked in. Let's just check the femur. So I'm also going to adjust the femur for rotation. I see this all the time. People who are having like knee pain, knee discomfort for no particular reason. So hold this out strong. Feel that? Now that locks in nice and strong, really easy. Let's just pull this out. Hold that strong. Good. Hold that strong. Good. Good. That feels, I mean, I think you have pretty good rotation there. I like that. That works good. So now just to make sure you're totally taken care of.
Sorry.
For what?
I'm gonna take my Vivo shoes off.
Well, your feet work hard. You doing good?
I'm alright.
Good. Got movement on that one. Yeah. Woo. Are you sweating?
I'm like nervous, clammy now.
You're doing great. Okay, anything else?
No, honestly, not that I can think of.
Okay, so let's recheck you. Why don't you stand up? Perfect. Okay, so just kind of shake it out. And tell me what you notice. How's that feel? Okay, let's try that activation again.
Am I pulling them back?
Yeah, you're squeezing right here.
They look a lot more even.
Yeah, level. Mm-hmm. Good. Okay, and then let's redo our squat test. I'll just slide this over. Okay. Go ahead. Yay!
Every time.
How did that feel? Any pinching
Better.
here?
No. Feels a lot more open.
Okay, come back up. Good. Let's do that one more time. Good, and come back up. So that one tracked really well. All right, good. Yeah, I mean, you didn't have a big problem before, so I think you'll probably notice next time you're in training. Now, if you get sore, that's pretty normal.
Okay.
Because it's been a little bit, and I just moved everything from your feet to your head. So if you notice soreness, it'll just feel like you worked out. It should go away in a day or so. You can use heat if you want, ice. I love soaking Epsom salt. It's always really good for recovery. Yeah, and then just watch those headaches.
Yeah.
How's that feel? Does that feel different?
Yeah. No, it's nice. I feel like this side really needed that. Because this was always like so tight. Like where you were pressing down on it, I'm like, yeah, that's exactly where it is.
Yeah.
So it's a lot better. Yeah.
Cool.
Thank
Good.
you.
Okay, anything else?
No.
Okay, well, we'll talk about what's next, but I know you know how to take care of your body. It sounds like you got nutrition right, you're moving. So now it's just making sure you're resting and recovering. And if you want to get adjusted, again, you're welcome to come back. Maybe in my athletes is anywhere from every 2 weeks to 4 weeks, sometimes 6 weeks. So you just let me know.
Yeah, absolutely.
Okay, good. Well, thank you.
Thank you.
Okay, we'll see you soon.